America! Let's talk about something that's guaranteed to leave a bad taste in your mouth. Even worse than finding out your favorite celebrity is actually a hologram. We're talking about the skyrocketing cost of prescription drugs. It's enough to make you sick, which is ironic because you probably can't afford the medication to get better. This isn't a new problem. We've all heard horror stories of people rationing insulin or skipping doses altogether because they can't afford it. But what if I told you that sometimes the price you're paying for your medication is artificially inflated? And it's all thanks to something called gag clauses. Hold on to your pill bottles, folks, because we're about to dive deep into the murky world of pharmacy gag clauses and the hidden costs of your medication. Now, you might be thinking, gag clause, what on earth is that? Sounds like something out of a bad spy movie, right? A secretive term that seems to belong in the world of espionage and covert operations. Well, you're not entirely wrong. It's secretive, it's manipulative, and it's definitely bad for your health, or at least your wallet. Imagine being in a situation where you need medication, and the person who can help you save money is forced to stay silent. In the simplest terms, a gag clause in the pharmacy world is like putting duct tape over your pharmacist's mouth when it comes to saving you money. It's as if they're being muzzled, unable to share crucial information that could benefit you financially. It's a contractual agreement that prevents pharmacists from telling you about potentially cheaper options for your medication. These clauses are often hidden in the fine print of contracts between pharmacies and pharmacy benefit managers, or PBMs. Let's say you walk into a pharmacy with a prescription, feeling like a character in a hostage negotiation because you know it's going to cost you an arm and a leg. You're already stressed about the high cost of medication, and the last thing you need is more bad news. Your friendly neighborhood pharmacist, who actually knows a thing or two about drug prices, might be aware that you could get that same medication cheaper if you paid with cash instead of using your insurance. They have the knowledge and the desire to help you, but their hands are tied. But thanks to the gag clause, they're legally bound to keep their lips zipped. This means that even if they know of a way to save you money, they can't tell you. It's a frustrating and unfair situation for both the pharmacist and the patient. The gag clause essentially prioritizes profit over patient care, making it harder for people to afford their medications. It's a practice that has been criticized by many in the healthcare industry, and for good reason. Fortunately, awareness is growing, and some states have taken steps to ban these clauses, but there's still a long way to go to ensure that everyone has access to affordable medication without unnecessary barriers. Let's make this real with a real-world example, shall we? We're diving into the murky waters of pharmaceutical pricing, where things aren't always as they seem. Imagine you need metformin, a common medication used to treat type 2 diabetes. It's a staple in diabetes management, prescribed to millions of people around the world. Now, this isn't some fancy new drug with a price tag that rivals a small car. It's not a cutting-edge treatment fresh out of the lab with a price to match its novelty. This is a tried-and-true medication that's been around for ages. Doctors have been prescribing it for decades, and it's proven to be effective and reliable. Let's say the cash price for metformin at your pharmacy is a very reasonable $10. That's right, just $10 for a month's supply of this essential medication. But you, being the responsible, insured individual that you are, hand over your insurance card, expecting a discounted price. After all, isn't that what insurance is for? To your horror, you're told your copay is $30. Yes, $30, 3 times the cash price you were expecting. $30 for a medication that costs $10. It's like a cruel joke, but unfortunately, it's all too real for many people. You're basically paying a surcharge for the privilege of having insurance. It's a bitter pill to swallow, pun intended. This is where the gag clause really stings. These clauses prevent pharmacists from telling you that you could get your medication cheaper without using your insurance. Your pharmacist, if they were allowed to speak freely, could tell you, hey, ditch the insurance on this one and just pay cash, you'll save a bundle. But their hands are tied. But alas, they're contractually obligated to stay silent, and you're left feeling like you just got fleeced. It's a frustrating and unfair situation that many people face every day. So who's behind these gag clauses and this whole convoluted pricing scheme? Well, it's time to shine a spotlight on the real villains of our story, pharmacy benefit managers. or PBMs for short. These guys are the puppet masters of the pharmaceutical world, and they're pulling all the strings. PBMs are supposed to be the middlemen between drug companies and insurance plans. Their job, in theory, is to negotiate lower drug prices for insurers, which should then translate to lower costs for you and me. Sounds great, right? Well, in a perfect world, maybe. But here's the catch. PBMs are playing both sides. They're negotiating deals with drug companies and then turning around and negotiating deals with insurance companies, all while padding their own pockets in the process. And the gag clauses, those are just one of their sneaky tactics to keep the profits flowing. Let's go back to our metformin example, shall we? Metformin is a common medication used to treat type 2 diabetes, and it's been around for decades. Despite its long history and the fact that it's a generic drug, the pricing can be quite perplexing. Remember how the cash price was $10, but your insurance copay was $30? This discrepancy is not just a simple oversight, it's a calculated move. Here's where the PBMs come in. Pharmacy benefit managers, or PBMs, are the middlemen who negotiate prices between pharmacies, drug manufacturers, and insurance companies. They might have negotiated a deal with the drug company to get the drug for super cheap, let's say $2. This is where their influence and power come into play. Then they turn around and tell the insurance company they can get it for a discounted price of, say, $25. The insurance company, eager to save money, jumps at the offer. The insurance company, thinking they're getting a good deal, agrees. They believe they're cutting costs, but in reality they're just part of the PBM's profit scheme. You, the unsuspecting customer, end up paying a $30 copay, which is 3 times the cash price. This leaves you wondering why you even have insurance in the first place. The insurance company is happy because they think they've saved money, and they pass on the cost to you without a second thought. And the PBM? Well, they're laughing all the way to the bank with a cool $23 profit. This profit margin is enormous, especially when you consider the volume of transactions they handle daily. It's like a magic trick, except the rabbit never reappears, and the illusion is that you're getting a good deal when you're not. And you're the one feeling like you've been pulled out of a hat. The frustration and confusion are real, and you're left questioning the entire system. The problem is, this whole system is shrouded in secrecy. The lack of transparency makes it difficult for anyone to understand the true cost of their medications. PBMs operate with a level of opacity that would make a black hole blush. Their dealings are hidden from public view, making it nearly impossible to hold them accountable. They claim their negotiations are confidential, which means that neither the insurance companies nor the consumers can see the actual terms of the deals. This makes it nearly impossible to determine how much they're actually profiting from these deals. The lack of transparency benefits the PBMs while leaving consumers and insurance companies in the dark. So, who's really feeling the pain in this whole mess? Well, apart from our wallets, it's the patients and the pharmacies that are bearing the brunt of these shady practices. For patients, it's a double whammy. They're paying inflated prices for their medication, often with no idea that they could be getting it cheaper. And even worse, they're being denied the basic right to make informed decisions about their own healthcare. Pharmacies, too, are caught in the crossfire. Not only are they prevented from providing transparent pricing information to their customers, but they're also losing out on potential revenue when patients are forced to overpay for medications they could have purchased at a lower cash price. This isn't just about a few extra bucks on your prescription, folks. This is a systemic issue that's driving up healthcare costs for everyone. When patients can't afford their medication, they end up in the emergency room, which puts an even greater strain on our already overburdened healthcare system. And it's not just about the money, it's about trust. When pharmacists, the healthcare professionals who are supposed to be looking out for our best interests, are silenced by these gag clauses, it erodes the trust between patients, providers, and the entire healthcare system. This lack of transparency and accountability is a breeding ground for distrust and cynicism, and it undermines the very foundation of affordable and accessible healthcare. So, what can be done about this mess? Well, the first step is to shine a light on these shady practices. We need to demand transparency from PBMs and hold them accountable for their role in inflating drug prices. Legislation has been introduced in some states to ban gag clauses and require PBMs to operate with a greater level of transparency. This is a step in the right direction. But we need a nationwide effort to rein in these rogue actors. We need to empower patients to be more informed consumers. They should have access to clear, concise information about drug pricing, including cash prices and insurance co-pays, so they can make the best decisions for their health and their wallets. The world of prescription drug pricing is a murky one, filled with hidden costs, secret deals, and gagged pharmacists. But it doesn't have to be this way. We can demand better. We deserve better. It's time to break the silence on gag clauses and bring transparency and fairness to the pharmaceutical industry. After all, healthcare is a right, not a privilege, and access to affordable medication should be a given, not a luxury. Let's make sure that the only thing getting gagged is Big Pharma's attempts to rip us off. I will show you how to get the best deal on your meds. Or, I think I messed up big time paying for my prescriptions. All right, let's talk pharmacy gag clauses. These sneaky little rules prevent your pharmacist from telling you if there's a cheaper way to get your meds. Crazy, right? Imagine this. You go to pick up your prescription and the pharmacist knows there's a cheaper option, but they can't tell you. It's like having a secret menu at your favorite restaurant, but you never get to see it. And these gag clauses have been keeping patients in the dark, leading to higher costs for you. But guess what? Knowledge is power now, and by understanding these hidden clauses, you can take control of your healthcare costs. So next time you're at the pharmacy, ask if there's a cheaper option. Don't let hidden costs dictate your health choices. Share this video with friends and family to shed light on this issue. Together, we can advocate for transparency and ensure everyone has access to affordable medications. Don't let hidden costs dictate your health choices. Spread the word and be part of the change.